is at no cost. Taifa Care is universal in both word and deed. These healthcare services deliver transformation goes beyond the magnitude of numbers or of new beneficiaries to real impact on citizens. SHA is settling payments promptly, ensuring that no Kenyan is turned away due to lack of funds. Additionally, to expand access to comprehensive inpatient care, the Social Health Authority is prioritizing the enrollment of all Kenyans with a particular focus on those in the informal sector, many of whom were previously excluded under the now defunct National Health Insurance Fund. Although informal households account for approximately 80% of the population, they have historically faced significant barriers to access health insurance. So far, 1.7 million informal sector households have successfully enrolled and paid for social health insurance, a record achievement representing the highest number of informal sector enrollment in a single year in the history of Kenya. To address persistent challenges such as irregular premiums and other contributions among informal sector workers, we are introducing an innovative and inclusive payment solution called Lipa SHA or Lipa SHA Mos Mos. This initiative enables Kenyans to remit their annual SHA contributions through flexible, manageable installments, whether monthly, weekly, or even daily, based on their financial ability. It ensures families maintain continuous health coverage without financial strain, while simultaneously promoting the sustainability of the health insurance fund. Lipa SHA has been made possible through a strategic partnership between the Ministry of Health, the Ministry of Cooperatives and MSMEs, mobile network operators, and financial institutions through the Hustler Fund. The system is simple and accessible to citizens. Citizens can dial *147# and follow the prompts to enroll and begin their contributions immediately. In addition to enhancing access to health insurance,